Welcome back, everybody. This Week in America, website thisweekinamerica.us. Celiac disease, gluten-free diets, maybe the most significant food trends of the past decade. To answer all of your questions about all of the gluten-free basics, back with us, as mentioned on the program, Dr. Susan Smith-Jones. She's made extraordinary contributions in the fields of holistic health, anti-aging, optimum nutrition, balanced living. Founder and president of Health Unlimited, an LA-based consulting firm dedicated to optimal wellness, health education, and human potential. And the author of over 25 books, including Recipes for Health Bliss, Detoxify and Rejuvenate, The Curative Kitchen, The Joy Factor, Walking on Air, your 30-day inside and out rejuvenation makeover. And she's with us today to make sense of all this gluten talk we're hearing out there, Dr. Susan Smith-Jones. Dr. Susan, welcome back to the program. Great to have you with us.
Thank you, Rick. It's wonderful to be back with you again. Thank you.
Well, it's a great topic, and we're talking gluten freedom, choosing, enjoying a gluten-free diet and lifestyle. First of all, let's talk about how important that is. I mean, it's difficult to find somebody talking about diet anymore that's not talking about gluten-free, celiac disease. How important a topic is this?
You know, you're so right about that, especially here in the West L.A. area. But
Yes.
You see, once considered a fringe way of eating for a small segment of the population that had celiac disease, gluten-free diets have become pervasive, like a mainstream food trend, and I think perhaps the most significant one in the past decade. I don't know if you saw this, but a couple months ago on Jimmy Kimmel Live...
Didn't see it, but heard talk about it. This is funny.
He had a little, the pedestrian question, and
Yes.
he asked people, what is gluten? You know, they first said, are you on a gluten diet? And they would go, oh, yes, yes. What is it? Nobody could answer what it was. And what I did, knowing we were just going to scratch the surface today, on my website, my name, susansmithjones.com, if you look in the navigation bar and go over to more articles, the first article is about this topic of gluten freedom. And right at the top, you can click a button and watch this segment on Jimmy Kimmel. If you want a good laugh, this is great.
Well, and it really sort of, it summarizes what we're dealing with, because for months people have talked about gluten, celiac, and I'm like, gluten-free, why? And their answer is sort of like, because. I mean, nobody could really give me a solid answer for this. What exactly is gluten? What are we talking about here? And then we'll talk about why we should avoid it, or some people should avoid it.
A good place to start here. Gluten is a protein, and it's present in all forms of wheat, like, regular whole wheat and bulgur, durum, semolina, spelt, as well as in barley and rye. And you see, the term gluten comes from the Latin word for glue. So it's not surprising that the main function of gluten, as far as baking is concerned, is that it gives dough the elasticity, helping it to rise and imparting that chewy texture.
Okay.
And gluten is different from proteins found in other grains, such as rice, and in meat. And it's been found to be very difficult for humans to digest completely.
So this is a problem, actually, that's probably been around for a long time. Did somebody just discover this a couple of years ago? Because it's part of the vocabulary now.
Well, it absolutely is. And, it's been a few decades now, with the development of high-yield wheat in the 50s and 60s, and then they introduced genetically modified wheat crops, and now wheat has more gluten in it than ever before. The geneticists have found that when you add more gluten to the wheat when you grow it, it yields better baking properties, such as fluffier results. But sadly, this commercially produced wheat flour that we have now is different than it was decades ago. It's inferior, it's bleached, it's chemically treated, but it's also supercharged with gluten. And it's not just limited to wheat products. Gluten is an ingredient that's found in an array of commercially prepared foods like deli meat, soy sauce, soup mixes, salad dressings, even in certain brands of chocolate. But it can also be found, and a lot of people, Rick, don't know this, found in cosmetics, hair products, toothpaste, even vitamins, and other kinds of personal products, in those health and beauty aisles.
So if someone really should not have gluten in their diet, they really need what they put on their face, what they brush their teeth with. Is it always listed in the ingredients under gluten? Can you find it that way?
No, it's not. So if there are products that you use a lot and you're concerned about, I always say call the company up and ask them. Now, especially if it's on your mouth, because it can be found in lipsticks. So you want to make sure that the lipstick you use, especially if you have celiac disease, you've got to make sure that it's not in the lipstick.
So basically all day you're licking gluten and don't know it.
That's right.
Wow. So I'm watching for it in my bread and that way, but I'm taking it possibly in other ways.
Well, I don't want to depress everybody listening, but let me go through a list of places that you're going to find gluten. So if you, and as we'll discuss in a moment, if you have celiac disease that's severe, it can literally be life-threatening if you consume lots of gluten and you're not aware of it.
I'm going to stop you just for a second. Celiac disease, describe the symptoms for that, because somebody might have that, but it's not at the severe or serious stages yet. What would be the symptoms of celiac disease?
Yes. All right. So some of the symptoms, well, first of all, symptoms of celiac disease, they'll vary from person to person depending on a person's age, the degree of damage to the small intestine, because celiac disease in the body touches off an autoimmune response that causes damage to the small intestine. It impairs absorption of nutrients. It leads to gastrointestinal distress, among other symptoms. So some of the symptoms that will come up if you have celiac disease will be malnutrition, and that can lead to anemia, osteoporosis, miscarriage, liver diseases, cancers of the intestine. Other digestive symptoms include, we hope no one's having a meal now, abdominal bloating and pain, chronic diarrhea, vomiting, constipation, unexplained weight loss or weight gain. Children with gastrointestinal distress that have celiac often are very irritable. And with children, it can be very serious because it's good nutrition is critical to a child's normal growth. And if you have problems with celiac at an early age, it can delay growth. It can affect your stature. It can delay puberty. And 1/4 of individuals with celiac have no intestinal, the gastrointestinal symptoms. They might have other symptoms like fatigue, joint pain, migraine headaches, arthritis, depression, anxiety, canker sores. I've got a whole list that you can read with all the studies and references on my website.
And I'll mention that. It's SusanSmithJones.com is the website. Our guest on the program, Dr. Susan Smith-Jones. When you're on the website, you can sign up for Susan's monthly holistic health newsletters. They're free. It takes about 10 seconds literally to subscribe. You'll be automatically entered into a weekly drawing for a 90-minute consultation with Susan. And there's great advice there. Go to the website, SusanSmithJones.com. If someone is listening and going, I've got some of those symptoms and I really haven't been able to figure it out, where's the best, how to go about testing? What's the first thing they should do?
Yeah, definitely. All right, this is a great question because the best place to start, Rick, is with a simple blood test that screens for celiac disease antibodies, because people with celiac disease who consume gluten have a higher than normal level of certain antibodies in their blood. It's the TTG antibodies. And about 98% of patients with celiac disease who eat gluten, the test will be positive. But it's important to note that celiac sufferers who've been avoiding gluten will get a false negative on the test, since the presence of gluten is necessary to generate those antibodies. And it used to be that you had to be on gluten for 4 to 6 weeks to come up in the blood test, but now there's a new and more sensitive blood test that may be accurate with only 3 days of gluten consumption.
Interesting. All this information available at the website, SusanSmithJones.com. Dr. Susan Smith Jones, our guest on the program. And you can link on at any time on our website, thisweekinamerica.us, and go directly to Dr. Susan's website. You were going to mention before the foods that contain gluten and the products. You were going to go through that list without depressing us, so please go ahead.
Please know, as I go through this list, I'm going to give you some positive news at the end.
Good.
But gluten can be found in, not just wheat products, but also termed under other names like durum flour, gram flour, semolina, bulgur, as I mentioned, lots of kamut and spelt. But certain grains like oats, because many people I know who want to be gluten-free will still eat oatmeal. But remember that sometimes the oat can be contaminated with wheat during the growing process. And in that case, if you really want to go gluten-free, you only want to purchase oats if they've been labeled as gluten-free. But here is a whole list of foods often made with wheat and gluten additives, because the gluten helps to bind things together.
Right.
Beer, breads, cakes, cereals, cookies, crackers, croutons, gravies, imitation meat and seafood, pastas, luncheon meats, salad dressings, soy sauce, soups and soup bases. And that gluten can be hidden in additives and other ingredients like malt flavoring, food starches, medications, and vitamins, Rick. They can be in vitamins, as gluten acts as a binding agent. So you've got to read labels carefully. And as I mentioned in lipstick, if this comes in contact with your mouth, and contains gluten, it can be very harmful, especially for someone with celiac disease. Now, I know this sounds like a lot to avoid, but here's the good news.
I was going to say, okay, the good news?
Please, Susan, I know. The good news is that there's a cornucopia of healthy and delicious foods that are naturally gluten-free, and these are your fresh fruits and vegetables, your beans, seeds, nuts, in their natural, unprocessed form, fresh eggs, lean meats, fish and poultry, most dairy products, and I'm a big believer in the Hawaiian spirulina and the Hawaiian astaxanthin, two supplements I'll mention in a moment, that if you're gluten-free or especially if you have celiac disease, you should always take both of those. But there are grains, Rick, you can eat, like rice, millet. You've heard of quinoa.
Yes.
Buckwheat, cornmeal. These are all wonderful, wonderful grains that you can still eat. And then, of course, you can go to the natural food sections of your grocery store or to your health food store. And most places now have gluten-free aisles. And you can depend on most of those foods to be gluten-free.
In all of the books that I mentioned, over 25 that you have written, are there any books where you have some gluten-free recipes that people could follow?
Oh, I do. I have a 3-book healthy living and nutrition series published by Hay House. And one of the books is a full-color recipe book called Recipes for Health Bliss. You can learn more about it on my website. Some great recipes there. Also, the other 2 in that set, one is the healing power of nature foods, and then the other one, Health Bliss, has 40 different green smoothie recipes. They're all gluten-free.
Interesting. Susan Smith Jones, Dr. Susan Smith Jones, our guest on the program. That's the website, SusanSmithJones.com. You got our website, thisweekinamerica.us, and link on to get that information. Time goes by so quickly. There's a lot of great information at the website. I want to talk about the risk and the benefits of a gluten-free diet for non-celiac patients. I mean, people are thinking, okay, that sounds like that's good. I should be avoiding that anyway. What are the risks and benefits for people that don't have a particular problem?
Well, some of the risks would be that you might have less nutrients in your diet because often the wheat products are fortified with B vitamins. And that can be very risky, especially if you are pregnant or want to become pregnant, because folic acid, one of the B vitamins, helps prevent birth defects. Without the wheat and the wheat products, you might have less fiber, so you want to eat more of the good whole grains without gluten, the fruits, vegetables, and beans. Also, let me just speak for a moment about cardiovascular health. It's been found that people on a gluten-free diet, and this isn't a risk, this is a benefit, have better numbers in terms of lower body mass index, lower weight, lower rates of high blood pressure. There was a recent study done, Rick, where they compared the health profiles of non-celiac wheat gluten avoiders to celiac disease patients and the general public. Those who avoided wheat and gluten definitely had lower weight and lower blood pressure and had better cardiovascular health. Also, lots of people go on a gluten-free diet because they find that they lose weight. Now, there's a lot of hype to that because you could eat lots of junk food, and even though it's gluten-free, and not be healthier or lose weight.
Right.
Junk food is still junk food no matter what. But if you adhere to a nutritionally dense diet of lots of fruits, vegetables, legumes, lean protein, nuts, and reasonable portions of gluten-free grains like brown rice and quinoa, you will undoubtedly find some weight loss benefits.
We've got a couple minutes left in the program. You mentioned before some natural supplements that help, especially if we're not real sure and we've decided to cut back on gluten and we don't want to miss out on some of the nutrients. What are some of the natural supplements that would benefit us?
Definitely. Yeah. See, gluten-free dieters should always consider, these are two supplements. Everyone who's gluten-free, I take them every day, and I'm fine. I don't have a gluten problem. And especially if you have celiac disease, you want to take the Hawaiian spirulina. Spirulina is a blue-green algae. It's naturally rich in iron. And it's been shown that many people that are on gluten-free diets, and especially with celiac disease, don't absorb iron well. And spirulina is rich in iron, and so many studies have shown that the iron in spirulina is easily absorbed in the body, which makes it an ideal choice for celiac patients. Also, because there's so much digestion, gastrointestinal inflammation, you want to take Hawaiian astaxanthin because it's the nature's most powerful antioxidant and anti-inflammatory. And again, in my article, under more articles all about gluten, I tell you why these two supplements are important and how to get them at a 25% discount. That's exactly what I do. I buy a 6 to a 12-month supply at once because you can use a code, Revitalize, and then you can buy them at a 25% discount.
You know, one of the nice things, and it's always a pleasure, and we have Dr. Susan on the program a lot, is that all the information we talk about, and we pack a lot into a short program, you can go to the website and find. So you don't have to take notes as you're listening to the program. If you go to the website, susansmithjones.com, you can get all the information there. Allow some time when you go there. A lot of great information there that will guide you through this. And with everybody talking about gluten freedom, you'll get all the straight information there. Doctor, unfortunately, we're out of time, but this has really been informative. I learned a lot. And basically, if we think we're susceptible, we really need to look at those ingredients and don't expect gluten to jump right out at you. You really need to know what all the ingredients are because it could be a code name for gluten.
Yeah, you need to be nutritionally savvy and probably take reading glasses to the store when you go down the aisles and really be careful about what you eat. And if you suspect you might have celiac disease, and you'll see in the article how prevalent it is, definitely check with your doctor about that first place to begin, getting that blood test.
Well, and if anybody ever comes up to you from a national television program and asks you what gluten is, if you've watched the program and gone to the website, listened to the program here today, you'll know exactly what it is. Thanks to our guest on the program, Susan Smith Jones, the website, susansmithjones.com. Dr. Susan, thank you so much for joining us on the program.
Thank you. I look forward to our next visit.
We will do that. We'll figure out another great topic, and we could have gone on for 3 hours about it today, but the information available at the website, once again, very easy, SusanSmithJones.com. Go to our website, thisweekinamerica.us, and log on for that information. You're listening to This Week in America, website thisweekinamerica.us.